Hello and welcome to the Johns Hopkins Comprehensive Transplant Center Living Kidney Donor Evaluation Education. Throughout this presentation, you will learn more about the benefits of living donation, the donor evaluation process, some risks of living donation, donor supports and protections, preparing for surgery, what to expect on the day of surgery, what to expect while you are in the hospital, planning for recovery and going home, post-donation recommendations and follow-up, and additional donor considerations. Benefits of living donation, kidney donor. There is no medical benefit to you by having a donor nephrectomy, which is surgery to remove your kidney. However, a possible medical benefit of undergoing donor evaluation is finding out about a health problem that you were not aware of, allowing you to seek early treatment. In the very rare event that a kidney donor were to develop kidney failure in the future, they will be prioritized on the wait list to receive a kidney transplant from a deceased donor. Benefits of living donation for the recipient. For the recipient, treatment of kidney failure includes kidney transplant, deceased or living donor, or dialysis. Receiving a living donor kidney transplant has many benefits. Transplant, in general, is a better way to treat kidney failure and reverse its effects compared to dialysis. For some, they can avoid dialysis. For others, they can come off dialysis, can undergo a transplant faster than waiting for a deceased donor, can potentially double the recipient's lifespan. Living donor kidneys work better and last longer than deceased donor kidneys. Surgery is scheduled. It frees up a deceased donor so someone else on the wait list can receive one. The donor evaluation process. On the day of your donor evaluation appointments, you will meet individually with the following transplant team members: nephrologist, surgeon, social worker, nurse coordinator. The independent living donor advocate will require a phone consultation after the donor evaluation appointment day. The donor evaluation is designed to ensure the safety of the donor. It includes a medical, surgical, and psychosocial evaluation. The medical and surgical evaluation will be conducted by our kidney doctor, called a nephrologist, and a surgeon experienced in living donation to assess and minimize risks of short and long-term risks of donation to the potential donor. This will include screening for any evidence of kidney disease and other medical illnesses, such as infections, heart disease, or other comorbidities that may directly or indirectly affect the kidneys or result in poor overall health and/or conditions that may result in surgical complications. A medical interview and physical exam will be completed. Standard testing includes a CAT scan of the abdomen and pelvis, chest x-ray, EKG, blood and urine testing, kidney function testing called a GFR. Standard testing will include routine community screenings. Routine community screenings are not covered by the transplant program. Screenings like cervical cancer screening, breast cancer screening, yearly well woman gynecological exams, colon cancer screening, prostate cancer. Recommendations as seen on this slide. There can be additional specialty consultations such as heart doctor clearance, and other testing may be needed and will be determined by the kidney doctor and the surgeon. The evaluation can reveal conditions that the transplant center must report to government authorities, such as HIV or other certain infectious diseases. Examples include hepatitis, HIV, and syphilis. These are routinely tested as they can be transmitted via organ donation. The psychosocial evaluation will be conducted by a social worker and, if needed, by a psychiatrist and psychologist with experience in transplantation to determine decision-making capacity, screen for pre-existing psychiatric illnesses, and evaluate for any potential coercion. All transplant programs must provide potential donors with an independent living donor advocate whose responsibilities include, but are not limited to, the following: promoting the best interests of the donor, to advocate for the donor's rights, to assist the donor in understanding information regarding the consenting process, the evaluation process, the surgical procedure, the benefit and need for follow-up. Our team reviews our kidney donor cases at our multidisciplinary donor selection committee. The team includes our doctors, nurses, social worker, pharmacist, independent living donor advocate, and dietitian. We review the medical, surgical, psychosocial information obtained during the evaluation process. Possible outcomes after all requirements have been met are: if anyone on our team requests additional testing or has an additional requirement, we would need to complete that prior to a decision being made. We are hopeful we will get kidney donors approved. Unfortunately, sometimes we may exclude someone from being a kidney donor if we think kidney donation may not be in their best interest, or something about the donor kidney may not lead to a good outcome for the transplant recipient. There may be more than one donor undergoing evaluation concurrently, as determined by the transplant team. Once a donor has been approved, the recipient team will be consulted for coordination of appropriate timing to schedule the kidney transplant and donation surgeries. To proceed with both surgeries, the recipient must also have completed their workup and be approved by their team for transplantation. Unfortunately, at times, we do need to exclude a person from being a kidney donor. If you are declined as a donor, you can still help your intended recipient. You can become a donor advocate or champion, which is a person who helps look for other potential donors to make the transplant happen. Once both the recipient and donor have been approved by their respective teams to proceed, a surgical date will be discussed. Generally, a date will be offered 4 to 6 weeks out. You will receive a preoperative letter with information about the location, date, and time of your surgery. Now we will discuss some risks of living kidney donation. Kidney donation is very safe. Although extremely rare, there is a risk of death after donation. Factors that have led to death in cases nationwide include infection, blood clots, and bleeding. This risk statistic is about 1 in 10,000. Every kidney donor will experience a decrease in kidney function after donation. The amount of reduction will vary based on the age and medical history of the donor. The long-term effects of having reduced kidney function on the overall health of a donor may also vary based on donor age and medical history. Although rare, there is also a risk of kidney failure, need for dialysis, or a kidney transplant after kidney donation. There is also risk of other short and long-term medical complications. Some are unforeseen. The evaluation test by itself can result in complications. For example, someone might have a contrast allergy to the dye from the CT scan. For women of childbearing age, there's an increased risk for preeclampsia and/or gestational hypertension. These risks will be discussed further by the nephrologist during your evaluation. Risks during the perioperative period include bleeding, surgical scars, infection, injury to other organs, abdominal or bowel symptoms such as bloating and nausea, developing a bowel obstruction or hernia, postoperative fever, pneumonia, nerve injury, urinary tract infections, developing high blood pressure and protein in the urine. Blood transfusions may be required in rare circumstance. Risks associated with anesthesia. Patients who have surgery and are immobilized are also at risk of blood clots in their legs, called deep vein thromboses. Increased risk of complications with the use of over-the-counter medications and supplements can occur. There is a very rare risk of interrupted surgery. The evaluation of the potential living donor and recipient does not stop when the surgery begins. It continues throughout the surgery. If at any point the surgical team believes that you are at risk or that the organ, the kidney, is not right for transplantation, the surgery will be stopped. Surgical risks will be discussed more by the surgeon during your evaluation appointment. There are potential for psychosocial risks, including a potential for problems with body image from the surgical scars, possibility of post-surgery depression, anxiety, or emotional distress, Potential impact of donation on the donor's lifestyle. Recipient complications can cause distress or anxiety to a donor. For example, the recipient can have a transplant rejection or other complications, including the need for retransplantation or death. The recipient may also have recurrence of kidney disease in the transplanted kidney that may shorten how long that transplant lasts. Financial risk associated with living kidney donation. Personal expenses of travel, housing, and lost wages related to donation might not be reimbursed. However, resources may be available to help assist with some donation-related costs. Childcare costs, possible loss of employment, potential impact on the ability to obtain future employment, potential impact on the ability to obtain or afford health care, disability, and life insurance, need for lifelong follow-up at the living donor's expense. Health problems following donation may not be covered. The transplant center does cover immediate post-surgical complications directly related to the surgery. However, for example, if a donor were to develop high blood pressure at a later time, this is an example of something that would not be covered by the transplant program. Donor supports and protections. Our transplant program participates with the Donor Shield Direct. This is a program that is administered through a third-party vendor through the National Kidney Registry. This program does include some cost reimbursements. Now, all reimbursements are made after the donation has been completed. There is allowance for lost wages. There are eligibility requirements. You must be a U.S. citizen and have a U.S. bank account. All reimbursements are made electronically. There is a maximum dollar amount up to $24,000, up to $2,000 a week for up to 12 weeks for lost wage reimbursement. Lost wage reimbursement more than 3 weeks requires approval by the transplant center. There's also reimbursement for travel, lodging, dependent or pet care. Combination of travel, lodging, and dependent care reimbursement cannot exceed $6,000. Dependent care for children or adult dependents of the donor and pet care such as boarding of an animal is also included. The Donor Shield Direct also has additional complication protection that would cover travel back to the transplant center for a donor. This program is subject to change based on the National Kidney Registry policy or participation. An additional resource for living kidney donors is through the National Living Donor Assistance Center. There are 3 things this program covers for eligible donors: travel expenses, lost wages, dependent care expenses. This program has eligibility requirements. Please contact our living donor social worker for more information and to see if you would qualify for this program. Preparing for surgery. Make arrangements with your employer to take adequate time off from work. Ensure a post-donation care plan with your family and friends. We do have concerns for respiratory illnesses surrounding the donation period. We do encourage COVID-19 and flu vaccination. Beginning 4 weeks prior to the donation, we would like you to take measures to reduce your risk for exposure to respiratory illnesses such as COVID-19, the flu, or any other respiratory virus. You can do this by avoiding crowded gatherings. Wear a mask while out in public. Wash your hands more frequently. If you were to contract a respiratory illness prior to surgery, that could potentially lead to postponement of the surgery. Hospital visitation policy will be followed and could potentially change based on hospital or state health policies. As we get closer to surgery, we will ask you to complete blood work at your local laboratory for cross-match testing. This is a test we do for donors and recipients to ensure no change in compatibility. Cross-match kits will be sent to you, or you may also have this completed at our Johns Hopkins Express Testing Laboratory. This testing will be completed at 2 separate time intervals, approximately 30 days before the surgery date and again 7 days prior to surgery. You will be scheduled for a pre-op appointment with our anesthesia department in the Johns Hopkins Pre-Op Evaluation Center. This appointment will occur usually 2 to 3 weeks prior to planned surgery. At that visit, you will meet with the anesthesia department, physician assistant, or nurse practitioner. Lab work may be completed at this visit or potentially earlier that will include updated screenings for infectious disease such as HIV and hepatitis. Hormone medications such as birth control or hormone replacement will need to be held 4 to 6 weeks prior to and after surgery. You will need to avoid medications and supplements that can increase the risk of bleeding or may interfere with anesthesia and other medications 2 weeks before and after surgery. Some examples include aspirin, the nonsteroidal anti-inflammatories, vitamin E, and fish oil. Check with our team after surgery to verify when you should restart any medications or supplements that were held before surgery. As a donor, we will ask you to follow a clear liquid diet the day before surgery, from the time you wake up until midnight. Do not eat or drink anything, not even water or gum, after midnight with one exception. On the way to the hospital, we will ask you to drink one 20-ounce bottle of Gatorade, any brand, any flavor, any color. This must be completed 2 hours before surgery. Our team asks you to arrive at Johns Hopkins 2 hours before your planned surgery time. If you have been instructed to take certain medications with a small sip of water, that is allowed. A clear liquid is any liquid you can see through. It's very important for you to remain well hydrated. This slide has examples of items that are allowed on the clear liquid diet and are not allowed. You will be asked to arrive at the Johns Hopkins Hospital Zayed 3 preoperative area at the time listed in your letter. This will be 2 hours prior to your planned surgery. Once you arrive, an IV will be placed and the surgical and anesthesia consent forms will be signed on the day of surgery. Our team utilizes a minimally invasive robotic laparoscopic nephrectomy unless there is an indication for another approach. Laparoscopic surgeries may lead to shorter hospital length of stays and recovery times. The expected length of stay at our hospital is 2 nights. Complications can prolong the hospital stay. Johns Hopkins donor outcomes are among the best in the nation. What to expect while you're in the hospital post-donation. You can expect to have pain, which will be managed by temporary pain medication. Gas pain is very common with abdominal surgeries. You can have a sore throat or hoarse voice. The procedure uses general anesthesia and a tube is passed down your throat, which may cause this. You can have referred shoulder pain, fatigue that may last up to 6 weeks, constipation, trouble moving your bowel after surgery. The team will get you up and walking. To help with this, drinking lots of fluids and provide stool softener medications. You will have surgical scars from your incisions. A urinary catheter will be inserted into your bladder during the surgery and will remain in place and be removed the next morning as long as the team is happy with your urine output. You will resume your diet with ice chips and clear liquids, and your diet will be advanced as your stomach is tolerating it. The team will have you sitting in the bedside chair and ambulating early, planning for recovery and going home. You will be discharged once you're eating, drinking, passing gas, and your pain is well controlled. A post-op appointment will be scheduled with our donor team within 1 to 2 weeks of discharge. A full recovery is expected to be 4 to 6 weeks. Most people will return to work in that same time frame. There is a lifting restriction of 10 to 20 pounds also for 4 to 6 weeks. Avoid strenuous exercising and contact sports for 6 weeks. Avoid submerging in water such as a bathtub, a swimming pool, hot tub, the ocean until your incisions are healed. A shower is perfectly fine. Driving is restricted for 2 weeks. If you happen to be on narcotic pain medication for a longer period of time, then driving is still restricted. You can resume sexual activity as you feel up to it, avoiding any position that may cause pain or put strain on your incisions. When you are discharged, we would like you to contact your post-donation coordinator with any concerns. You will be given a Monday through Friday office hours contact number, as well as an after-hours, weekend, holidays, 24-hour on-call transplant coordinator contact. Please call us immediately if you were to develop a fever 100 degrees or higher, your wound is red, more painful, has drainage, or the incision looks as if it's pulling apart. You become nauseous or vomiting and cannot keep food and liquids down. Your pain worsens and cannot be controlled with the medications we prescribed. You find it difficult to have a bowel movement or have multiple loose stools in a day. If you have foul smelling or cloudy urine, or an urge to urinate frequently or feel burning on urination, we would want to know, because you can develop a urinary tract infection from having had a catheter. Post-donation recommendations. We will advise you to drink plenty of fluids and stay well hydrated. You should be drinking 2 liters of fluids a day. Avoid the nonsteroidal anti-inflammatory medications post-donation long-term. Examples include, but are not limited to, Advil, Aleve, Motrin, ibuprofen, and naproxen. These medications can be nephrotoxic, meaning bad for your kidney. Tylenol is recommended as the acceptable alternative. Aspirin 81 milligrams is acceptable if clinically appropriate. Long term, we do want you to avoid IV dye contrast unless absolutely necessary. This is a type of dye that is typically used in CAT scans or other diagnostic imaging exams. It is important to communicate with your provider after kidney donation to ensure that they are aware that you were a kidney donor. The team also advises that you do not take unregulated herbal medications. Some cause kidney failure. Avoid long-term use of proton pump inhibitors, if not indicated. Examples include Prilosec, Prevacid, Nexium, Protonix, Acifex, and Dilexident. Long-term use of these medications has been associated with chronic kidney disease. Please discuss continuous usage of these medications with your provider. There is an alternative H2 blockers, such as Tagamet or Pepcid. Some medications may require dose adjustments after kidney donation based upon your residual kidney function. Our post-transplant office is always available if there is ever any question associated with medications. Take precautions to avoid injury to your remaining kidney. For example, contact sports. You will want to protect your remaining kidney from injury. Maintain your overall health and always protect your remaining kidney. You can do this by maintaining a body mass index of 30 or less. Ensure your blood pressure is always monitored and well controlled. A goal would be 130/80 or lower. Exercise regularly. There are no dietary restrictions after donation, but you are encouraged to eat a healthy, well-balanced diet. Avoid all tobacco products. Maintain community preventative health care screenings as you go through life. See your primary care physician annually, more frequently if indicated. Make sure all health care professionals taking care of you are always aware that you were a kidney donor. Required post-donation follow-up. Our post-donor team will follow you remotely for 2 years at the following intervals: 6 months, 12 months, and 24 months after your kidney donation. You will be asked to complete a health questionnaire and complete some basic lab work at your local laboratory. We encourage you to contact our post-donor nurse coordinator for any concerns related to kidney donation. Additional donation considerations. A donor may decline to donate at any time. Donors will have sufficient time to reflect upon consenting to donate and making an informed consent. Donors will have the option of a general, non-specific statement of unsuitability for donation should the donor wish not to proceed with donation. The decision not to proceed with donation can only be disclosed if authorized. The team will only issue a generalized statement that a donor is not a candidate and not suitable for kidney donation. Donors cannot receive valuable consideration for agreeing to be a donor, including monetary or material gain. This is considered illegal in the United States. A donor's medical information will not be revealed to a potential recipient unless authorized by the donor. If a donor has a condition that might harm a recipient, our team will not allow the donation to occur. At the time of your evaluation appointment, we will have you sign this signature page confirming that the education has been completed. You may contact your coordinator with any questions or concerns. Thank you for taking the time today to review the kidney donor education.